Hi, I'm Deborah Grenard. Welcome to the Healthy Family Revolution, a summit for cultivating physical, mental, emotional, and spiritual health in today's children, tomorrow's leaders. I have with me today Dr. Tetyana Obukhanych. Dr. Tetyana is going to talk to us about vaccines and the immune system, a very hot topic these days. I'm so happy to have Tetyana with us. Thank you for being here, Tetyana.
Hi, Deborah. It's my pleasure joining you, and I'm sure I will enjoy our conversation.
Oh, me too. Me too. So I'm going to read for you Dr. Tetyana's bio, and then we'll jump right in because she's got so much to offer. It's amazing. I can't tell you how honestly pleased I am that she's here. I've had the opportunity to take a class on immunology and vaccines and the immune system with Tetyana, and it was an amazing class. I learned so much. So, you know, when I got the idea to do this summit, she was one of the first people on my list to contact about being a part of this, because her information it's one of those that, you know, when you learn something and you say, oh my gosh, everybody needs to know this. We've got to get this out. So, all right, so let me get on with the bio, and I'm going to read her bio. Tetyana Obukhanych is a PhD in immunology. She got her PhD at the Rockefeller University in New York, New York. She has been involved in laboratory research as a postdoctoral research fellow with the leading biomedical institutions such as Harvard Medical School and Stanford University School of Medicine. And then she has fully devoted herself to parenting. Dr. Tetyana, thank you again. So why don't you start by telling us about you and why you're interested in this topic, how you got here?
Well, obviously, when someone becomes a parent, priorities shift. And I've been involved a lot in education, in higher education, getting PhD, doing research. But once the baby shows up, it's the priority. And one of the things that needs to be done are vaccination decisions. Now, because I have my professional background in immunology, I thought that's a really big advantage in that I'm able to look at the research data myself and decide for myself about vaccines rather than just go on the CDC website and take that information for granted. So that was one of the reasons why I'm interested, because I'm a parent and a PhD in immunology. But another question is, of course, not every PhD immunology questions what is on the CDC website. A lot of my coworkers and my fellows and friends, they just go along that. So what brought me to question that information or wanting to find out for myself whether that information is correct is my personal experience. And what that was is that when I was a child, I received my vaccinations on schedule as expected. And despite that, I got those diseases, those vaccine-preventable diseases. And measles was one of them. So because of that experience, I really needed to understand what is this about? Why is it that I was vaccinated and still got diseases? Because that goes against the dogma. It goes against what we know in immunology, what we believe in immunology. So I didn't want to think of that as, well, this is just an irrelevant exception, what happened to me. I really wanted to understand fully what that was about, because based on that, based on clearly seeing why that happened to me, I would be able to make better decisions for my own immunizations in future or for immunizations for my child.
Mm-hmm. Okay. So regarding immunizations, I mean, can the body fight viruses naturally?
See, this is the thing, is that we so much believe in vaccines that we think that without vaccines, our bodies are not going to be able to fight viruses. Now, what I realized is, for me, even though vaccines, I was vaccinated and I still had to go through natural infection. And, I had to look into how is it that the body fights viruses. In those, at least in those cases, the vaccines don't help, or there is a vaccine failure or something else happen. How does the body fight viruses? And what I found in immunologic research is that there are other mechanisms in the immune system that allows us to survive viral infection and sometimes even go through viral infections without disease symptoms. And the more I looked into that research, the more fascinating it became. For example, I didn't know that, but a study showed up recently that 75% of flu infections go without symptoms. So you have a flu virus in your body, your immune system is dealing with that, and you have no knowledge of that. On the surface, you look like completely healthy. And so there are also other examples with other diseases. Rubella, for example, it's really well known and is even written on the CDC website. 20 to 50% of rubella cases go what is called asymptomatically.
Okay.
Well, you would think, well, how about...
Which means no symptoms, right?
No symptoms, yeah, you don't know. And you are going through infection and establishing your immunity from reinfection so that you don't even go for a symptomatic infection second time. And you don't know, it's all under the radar.
Wow.
And the most surprising thing was with Ebola research. Another study recently showed up that there are some people who have evidence that they went through Ebola infection and they had no symptoms of disease whatsoever. So
wow.
I was thinking, well, maybe, Ebola or these scary diseases are exception, and if you get those, you will definitely, be almost dead. But no, there are examples, and we need to know more about these mechanisms in the immune system. But for things like common childhood diseases, I think the mechanisms are pretty clearly established, and there are ways to strengthen those mechanisms if you do not want to rely on vaccines and risk vaccine adverse effects or vaccine failures, both ways. There are ways to strengthen those other mechanisms.
Okay, so, well, first, can you talk about then why we have vaccines, why we need vaccines?
Well, obviously, historically, yes, it was observed that a disease like measles would take a quite severe route in a lot of people or a lot of children. And so there would be some children who go through measles pretty easily without complications, and there will be others who would get pretty severe symptoms and still go through it and recover. And then there would be like a third category that would get really severe complications that like pneumonia, secondary pneumonia, or encephalitis, and even die from measles. So obviously there is a range of the way one can respond to infection, and it depends on how well those endogenous mechanisms of the immune system work. So because of the worst case scenario, it was assumed, well, we need to eradicate the measles virus so that those worst case scenarios do not happen, even though now we know how to prevent that. So for this reason, the mass vaccination was introduced in like one country after another. I think it always starts in the United States where vaccines are produced, and then other countries adopt that policy. So this vaccination is for eradication of the viruses, mainly, not so much for preventing disease in you, because there are other ways of maybe not prevent disease per se, but reduce the severity or eliminate complications and just make the disease go smoothly. But I guess we are still in this mentality that we want to eradicate the viruses because they are considered our enemies, our biological enemies. So that's what mass vaccination is for.
Okay. So you just mentioned there when you were talking about the three categories. When you said, the severe category, even though we know how to prevent that now. Can you say more about that?
Sure. And I would think that for the innate mechanisms, the ones that do not rely on vaccination, but the innate mechanisms that operate in the immune system to make infections mild or symptomatic.
Mm-hmm. That's the natural immune system without any outside boosters.
Without any man-made interventions.
Okay.
So for that part requires really good nutrition. So this is what I learned based on the research in immunology, as well as on personal experience, that nutrition is number one thing that we can change, and we can make sure that those mechanisms work. So if we would say, well, what is specifically about nutrition that would make immune system work? What is known? There are at least two vitamins that are extremely important, vitamin A and vitamin D. And there is a lot of research around those vitamins in how exactly they instruct the immune system to perform correctly the functions such that the antiviral mechanism is not going to be compromised. And for that, you need vitamin A. And vitamin D is really important for antibacterial mechanisms. So one or the other or both together would be optimal, would be the most optimal thing. And I know that you will immediately right away ask me, like, what are the doses, right? And how often we have to take it. The thing is that we always tend to think about vitamins in form of pills, and that's really not how, in vitamins occur in nature. So in nature, they occur in food. And obviously during the summer, you also have vitamin D from sunshine, that your skin produces vitamin D. Well, during the winter, that doesn't happen. So during the winter, people get to be vitamin D deficient. So that's when they have to supplement. And how do you supplement? Well, there are traditional cultures that instead of relying on pharmaceutical or form of vitamin D, they actually did something like cod liver oil that naturally has vitamin D in it. Okay. And this is something that still can be purchased here, but there are different forms of cod liver oil. There are some forms that are prepared more like in a traditional way, and they're called fermented cod liver oil. And there are more industrial cod liver oil, which is prepared with a lot of heat and other extreme harsh processes that can destroy lots of good things in it. So in my family, we rely on fermented cod liver oil to stay as much as possible close to the traditions that they were happening over time in the past. And so based on my own experience of measles, as I said, I had 2 vaccines in the childhood, and then about 5 or 6 years after the last vaccine, I got measles. So my measles happened when I was around 11 or 12. Okay. I would put myself into category number 2. So my measles wasn't completely mild. It was quite severe. It felt like extreme flu plus rash. Okay, so extreme flu symptoms like very high fever, very strong cough. And then on day 5, the rash came out, and then we said, okay, that was not flu, that was measles. And so that was like number 2, but I didn't have complications like pneumonia or something that might result into lifelong impairments or death. So obviously I was in this middle category. And why I think I was in this middle category? In Ukraine, so that's where I was born, we had really good diet in terms of vitamin A. Okay, so I don't think I was deficient in vitamin A. And if I were deficient in vitamin A, or any kid is deficient in vitamin A, what happens during measles is that they get photophobia. So that's a symptom that the body is using.
They get what? Can you say that again?
Yeah, it's photophobia. It means that they're very sensitive to light, and they have to stay in dark room during measles. And I think you will hear a lot about it if you read some literature on measles. Okay. That didn't happen to me. Also, I didn't have diarrhea, and some children experience diarrhea, and that's again a vitamin A deficiency problem. Okay. So, but what I had such strong respiratory symptoms, beyond description. And what I know is that is more related to vitamin D deficiency. So respiratory symptoms and vitamin D deficiency go together. So, and in Ukraine, we had absolutely no tradition to supplement with cod liver oil or take even artificial supplements for vitamin D during winter. It was just not part of the culture. And so I think that was the reason why I experienced measles that particular way. Now, if you go to Africa and you see what's happening with measles there, their children are vitamin A deficient. And what you see is extremely high mortality, extremely high rates of pneumonia, or secondary infections. So you see how region by region, there would be different manifestations of measles. And the ideal form of measles would be like very mild symptoms, respiratory symptoms of very mild sickness symptoms, and rash on your body that lasts about 7 days. Okay. And rash by itself is not really, rash is not a problem. Rash didn't kill anyone. And so what is actually rash, we have to understand. The thing is that measles virus gets into the body and it affects some cells. It infects lymphocytes. And lymphocytes are just white blood cells in the blood. And so all these infected cells, they have to be killed and cleared by the immune system because the immune system doesn't want the virus to linger in the body forever and set a chronic infection. So it needs to get rid of those virally infected cells, and they have to go somewhere. These dead cells have to go through capillaries up to the skin, and so that's what rash is. So having rash is actually a good thing. It means that your immune system is working and getting rid of all these virally infected cells, and there is nothing to be scared about rash per se. So I don't really see why measles needs to be prevented if it can be, with good nutrition, brought to such a mild, disease. Mm-hmm. And, rash will happen one way or another. You cannot prevent rash with nutrition, obviously, because that's a healthy immune response. But when someone is deciding whether they should go with vaccine or with disease, obviously it's good to have disease in the mildest form possible, and that's where nutrition comes in.
Okay. Now, you mentioned about, the natural sources of vitamin D. Can you say more about natural sources of vitamin A?
Yes. So natural sources of vitamin A, and specific form of that would be retinoic acid. So not beta carotene, which is in carrots and in vegetables, but retinoic acid, and it is in foods that are of animal origin. So it would be in eggs and in milk or butter because it's fat-soluble vitamin, so it will be in the fat portion of milk and eggs, I guess. Now, but there is a difference. Depending on the source of your eggs and butter, there would be different content of vitamin A. And so what we have in our standard American diet is, unfortunately, those are very poor sources of vitamin A because those animals are given food which doesn't have much nutrition, right? It's like cows are given corn and soy instead of being on the pasture. And where does their vitamin A come from? It comes from the grass, so they convert beta carotene from the grass into vitamin A, and then we have it in a ready-made form. So the best way to go after vitamin A-rich nutrition is to change the source of your food. So if it's butter, it has to be from grass-fed cows. If it's eggs, it has to be from chickens that have access to some pasture and that they can clip grass, because this is where they get their beta carotene and transform it into retinoic acid for us. So there is a big difference between what is called standard American diet and a diet that you could read about or get familiar with, which is in Western Price guidelines. And Western Price Foundation is specifically alerting people on how to get the best nutrition out of what is available here now. Okay. So I would strongly recommend people to look into Western Price guidelines for nutrition and stick to that as closely as possible.
Okay, good. So humans can't just eat greens and things like that and get the retinoic acid. It has to come from animals who have eaten grass.
See, it's not like that. It's not black and white. So humans can indeed convert beta carotene just like cows do or just like chickens do. It's just that it requires additional effort, additional metabolic steps. And it's one thing to have it ready-made versus having to convert it and make sure that all these metabolic steps work along the way, and they will be using up other vitamins for conversions and everything else. So if someone is vegan and cannot eat eggs, they have to make sure that they have a lot of beta carotene in the diet from natural sources, and maybe even test their blood levels for vitamin A just to make sure the conversion happens. But for those who can eat eggs, I guess that's the best.
Okay.
To get vitamin A. And again, cod liver oil has a lot of vitamin A. Probably fish like salmon would have that. I know caviar, which is like Russian delicacy, has a lot of vitamin A. So there are good sources of that naturally. Just sometimes people are restricted in what they can get.
Okay. Okay. So now I'm curious. Can you talk about, and I know we didn't talk about this ahead of time, but can you say about the breastfeeding and the mother's milk for a child? Is there we're talking about cow's milk and that, what about the mother's milk? How does that affect the immune system of a child? Is there, I guess
yes.
My question is there a way like a mother can take care of herself that's going to help, if she's breastfeeding, help the child?
Absolutely. And that's because vitamin A and vitamin D, both of them go through the milk, through breast milk from the mom to the baby. So that's how the baby naturally gets these vitamins before they can eat any solid foods. And in breast milk, there is a lot more than just vitamins from the mom to the baby. All the antibodies that the mom has accumulated from being exposed to all kinds of infections in her childhood, recent, everything, and even at the time when the breastfeeding happens, all of those antibodies are going to the baby, and they help shield the baby from those infections. So it is almost like a natural immunization in a way, except that it's not going to last forever for the baby. So as soon as breastfeeding stops, well, that protection goes away. So eventually the child grows up and gets weaned, and they have to rely on their own immune system and their own endogenous mechanisms to handle infections. But during those vulnerable months in the beginning, it's maternal protection that helps to shield baby from infections. And for example, in the past, when measles was very frequent, and pretty much everyone got their measles as children, mm-hmm. but there wasn't any measles in infants. So infants, they were really shielded from measles despite a lot of exposure, and that's because their maternal immunity was protecting them. So they didn't need a vaccine during those early months, and vaccine is not even given until like 1 year of age. But they were really shielded, and they were not at risk of measles before.
Okay. Okay, so with like, I know I know like I as a child was not breastfed. Can you is there any part of being breastfed that has a lasting effect on developing the immune system?
So it depends how lasting you want it to be, right? So something that lasts all the way into middle age, I don't know. I don't think there is such a long effect, but there were effects that were observed beyond breastfeeding, beyond the timing of breastfeeding, but it was still within childhood. And that was protection for meningitis, for example. So what they found is that breastfeeding in Sweden, study was done in Sweden, could protect from meningitis, and it had to be exclusive breastfeeding. Okay, not just mixed with something else, but exclusive breastfeeding for at least 13 weeks of age. But the protection against meningitis lasted beyond that window. So it seems like breastfeeding sets up certain things, and I have a suspicion what it is. I think it's setting up the right gut flora. So gut flora is like repopulating or populating the gut with beneficial bacteria, which take on this additional layer of protection to fight or like to compete with less beneficial strains that could cause disease. And so these, the microbes are figuring out it between themselves and they're protecting us that way. And so breastfeeding is very is known to have a positive role in establishing beneficial bacteria in the gut of babies, and that could have lasting effects on health later on.
Okay, and I think I've heard you say before that beneficial gut flora also affects the vitamin D.
Yes,
Did I hear that correctly?
Yeah, so the way it affects vitamin D is that it helps the immune system to utilize it. So it creates or improves the receptor for vitamin D. Without a receptor, vitamin D is not able to act. We can have tons of vitamin D, but it's not going to do anything if there is no receptor for it. And so beneficial gut flora helps maintain those levels of receptivity, so to speak, to vitamin D. So together with vitamin D and beneficial gut flora, together they work synergistically.
Okay, beautiful. See, I paid attention in your class.
Good to know.
Okay, so so you got vaccinated for measles as a child, yet you still got measles, would you say 5 or 6 years later? Can you talk about the like why that might be?
Sure. Yeah, I did investigation of that to see whether it happened only to me or there are other reports in medical literature or epidemiologic literature. And the best explanation that I can give is that vaccine immunity goes away over time. So let's say you got vaccinated, and they can even measure antibody levels before and after vaccination, and they can establish, well, vaccine actually worked. The antibodies are there, but those antibodies, they don't stay there for the rest of your life. It was actually believed in the past that they do because it was just an assumption. But when actual measurements were done on a group of children who were vaccinated in the United States, I think in maybe 10 years ago that study came out, they found that vaccine antibodies just go away at some point. And so for me, it happened pretty fast. Within 6 years, those antibodies went away below the levels that are protective. And then the measles came to my town or whatever, and I got exposed and I got measles. And for some other people, these antibodies wouldn't go away that fast. They would go away slower. And so what does it depend on who gets protection longer or shorter time? This phenomenon is called low responders or high responders to the vaccine. So obviously I was a low responder. I generated antibodies, but maybe very low levels, and then they just waned away. Someone else could be a high responder, and for them, vaccine protection will last longer, but there is no way really to tell ahead of vaccination who is who. And there are several factors that could play a role in that. One is immunogenetic factors. So something personal to your genetics. It has nothing to do with being immunocompromised, not that kind of thing, but just very minor variations in genes that affect your immune system. Another thing is gender. It is known that women actually produce more antibodies than men.
Okay.
Just like on average. And that probably has something to do with us having this function to nurse our babies, and so we need to deposit more antibodies into them with breastfeeding and so forth. So women produce more than men, and also it depends on the state of nutrition at the time of vaccination. So they did studies in Africa where they compared malnourished children and well-nourished children and how they respond to vaccines. And malnourished kids, they just did not respond to vaccine. So all these factors play a role, and it's a mix of everything.
So that's interesting because nutrition plays a part in the body's natural immunity to fight a disease. It also plays a part in whether or not the body can make good use of the vaccine itself.
Sure. And the thing is that vaccine is pretty much a mimic of a natural infection. It's just that it is done on purpose rather than wait until it happens. And what they do, they just use an attenuated version of the virus or killed version of the virus. So in a way, it's an immune response that to some degree mimics an infection, but not all aspects of infection. And so obviously there will be a parallels between what is required for natural infections to go through them smoothly and what is required for vaccine to work, and even maybe what is required for vaccine not to give you a adverse effect.
Yes. Okay. So, all right. So, all right. Two questions that come from that. So the first question, now, if you get the virus naturally, do you build the antibodies? Do you keep the antibodies permanently from that, or do they also attenuate?
There was a study on that. And that was done in Japan. They compared the levels of antibodies in those who are naturally immune over different age groups. The oldest age group was over 60 years of age.
Okay.
And they showed that in those elderly, the levels of antibodies for measles, from their natural measles, which they got sometime in their childhood, it was really high. So there was no indication that elderly are susceptible to measles. And we know that from centuries of experience that no one gets measles twice. And old people don't go for measles again. So for natural infections, that immunity lasts and lasts and lasts. But when they compare that to vaccinated people of different age groups, and the oldest one was 30 years old because vaccination didn't start until recently, especially in Japan. So they could only have like children and adults, or middle-aged adults maybe, or younger. And so there they saw that the levels of antibodies to start with, they were about 10-fold lower compared to naturally immune levels. And then
to start with that at the young age?
Yeah, even like when they are really close to their vaccination.
Okay.
So
wow.
vaccine induces maybe 10-fold lower antibodies than natural infection, and then it goes away at different rates in different individuals.
Okay, so then you're susceptible again.
Yes.
If you have the vaccine, but if you get the disease naturally and have the natural antibodies, you're not.
Yes.
Not likely to be.
Not likely. And it's just because of the levels, the robustness of the levels that is generated through natural infection.
Okay. So that's very, very good information to have right there. So and it's a little bit scary because, with oh gosh, I'm thinking, for those of us who had vaccines at a young age and didn't get these diseases, then we're going to be more susceptible to them. All the more reason to keep a healthy nutrition for the body as you get older, because you could possibly be susceptible to these viruses again. But if you had them naturally, you're not going to be.
Yeah,
okay.
I would say that even if you had the measles naturally, or someone who is watching, you still have to take care of your immune system because there are so many other viruses around, and they all use the same mechanisms. Our immune system uses the exact same mechanism for protection, which involves what I mentioned, vitamin A, and the mechanism for bacteria, which involves vitamin D. So even if you think that you are not susceptible to some viruses, and that you can count them on your fingers pretty much, there's tons of other viruses out there. So one way or another, taking good care of the immune system is a must for everyone.
Beautiful. Okay. Yeah. Okay. So then, in terms of if you choose to vaccinate, first, can you talk about risks of choosing to vaccinate? Because there's still a lot of controversy around whether or not vaccines are safe. I know a lot of people are like, vaccines cause autism, they cause this, they cause that. Can you talk about, what is it contained in the vaccines that present some risk, and say more about that?
Sure, and I can address that from immunologic point of view, not from clinical point of view, because I'm not a medical doctor. But what I see is that vaccines are designed to work along two distinct mechanisms. Some vaccines are, like measles vaccine or MMR, they have live viruses. And other vaccines don't have live viruses, but they have what we call adjuvant, aluminum in it. And so depending on whether vaccine has aluminum or whether it has live viruses, there would be a different direction in which the immune response has to go. And in the immunology, we call it Th1 response or Th2 response. Now, the worst thing that can happen is that you respond inappropriately to the live virus. For example, the live virus needs Th1 response. Now, but if you were to mix MMR and administer it together with the vaccine that has aluminum in it on the same day or in the same leg or in the same arm, the immune system will get confused, most likely, and will throw a Th2 response against a live virus. That will be really bad because Th2 response will not allow to generate cells that can kill the live virus. So you can get stuck with a chronic infection from that measles vaccine because it's a live virus and the immune system got confused and generated a wrong response to it. So to me, I think the biggest concern is that all these vaccines are administered together on the same visit. For example, visit during the 12 months appointment, they have 9 needles administered at once. And so obviously babies have only 4 limbs. So then you have to administer at least 2 or 3 vaccines into one limb. And if the combination is wrong and you get like MMR plus hepatitis B vaccine, which has alum together in one limb, I think it's a recipe for disaster, really. So I think it would be really safe for those who are safer, at least for those who do want to vaccinate, to space vaccines, never administer alum vaccines and live vaccines at the same appointment, and really look at the list of vaccines. Now we have so many, and really see, well, which ones you need for short-term protection. We know that vaccines are only giving you short-term protection, and then you have to do boosters again and again. Or which ones are not really necessary during early childhood, and maybe one can do it later when maybe you think they're more necessary. For example, hepatitis B, like there is no much risk for hepatitis B for babies. So,
but that's one that they're giving at 12 months?
That's one they're giving on day 1 as a first dose, and then there are 3 more doses during the first year. So that's like how the schedule works with these aluminum vaccines. And I would say just bring that schedule to the minimum that you think is required for your baby in your particular situation, and then also remember that the vaccine protection is never lifelong.
Is never what? I'm sorry?
Lifelong. It doesn't give you
lifelong. So it will, the antibodies will be reduced over time.
Yes.
And then you still have the susceptibility.
Yes.
Okay. So, all right. So you choose to vaccinate. There's so much pressure to vaccinate right now, right? There's so much pressure to vaccinate your children. And there's a lot of guilt trip put on parents about, you've got to vaccinate or else you're risking the entire population if you choose not to vaccinate your children.
Yeah, so let's address that.
Yeah,
because,
okay, good.
It's not really the entire population, but there are certain segments of population who are not capable of withstanding infection on their own. And that would be immunocompromised individual, someone who is going through chemotherapy, for example, because chemotherapy really wipes out the immune system. We know that. Okay. So, but there is actually a treatment for them. If they're exposed to things like measles, they're not entirely, defenseless. There is a treatment called immunoglobulin, which is a transfusion of ready-made antibodies into their bloodstream to give them immediate protection from that exposure. So they don't have to be vaccinated. They cannot be vaccinated with live viruses because even that will put them in danger. But they have this treatment, and that treatment preceded the use of vaccines. So in a way, when we say that viruses are dangerous to them. Well, yes, unless their doctor knows that if exposure happened, that they should get, administered with this immunoglobulin, and then there is no problem. So, that piece of information, I think, changes things, how you think about whether we need to vaccinate our kids for the sake of someone else's kids, knowing that vaccine will not even last that long, that there are vaccine failures. So even if we vaccinated our kids, they can still contract measles and transmit it. So it's like one way or another, there is danger for someone else. But knowing that there is this personal protection for immunocompromised with immunoglobulin, I think changes things around.
Okay. Because I remember when I was a kid, everybody just got measles, everybody got chickenpox, and it was your parents wanted you to get. They would intentionally make sure you got exposed young, so you got it young and got it over with, and then you didn't have to worry about it anymore. It's like, what happened to that? Why are we so afraid now?
I think we are afraid because we forgot what mild measles is supposed to be, and we are scared with the statistics that, somewhere in Africa, this many kids die from measles, but that's because they're vitamin A deficient. That doesn't have to happen here, especially if you pay attention. And even here in the United States, there was research showing that people who end up hospitalized for measles, there was some vitamin A deficiency. So there is some correlation between vitamin A levels and who did or did not get hospitalized. So I think it's in our hands to ensure with proper nutrition that we can reduce the severity to the minimum and not be afraid of that.
Okay, good. So again, then, if someone chooses to vaccinate, can you, any more you want to say about what they should do to reduce the adverse effects?
Well, I just said, like what I said before is to choose the minimum of what you think is absolutely necessary for your child in your particular situation, knowing the risks of diseases and how likely it is that a child will even contract it or exposed to it, and then do these vaccines one at a time and never mix aluminum vaccine with live virus. And even for aluminum vaccines, space them out, because if you get too much aluminum at the same time, aluminum actually does cause fever. It activates the mechanism just like viruses do. It's called the inflammasome, that a child can experience an adverse effect as too much aluminum is given at the same time. Okay,
and then what about the age of the viruses and choosing age as far as, what choice you have there?
See, the thing is that as you postpone these vaccinations, they are required less and less. So let's say it's only during this very young age that measles is dangerous to babies. And I said in the past, they were not dangerous because maternal immunity was there to protect them. But now, because maternal immunity is no longer there, because vaccine antibodies wear off, and by the time when moms are old, they're like of, a reproductive age, women of reproductive age, they don't have much left to protect their babies with. And now modern babies are facing this risk. If they were to be exposed to measles, they will need immunoglobulin. So they are pretty much the immunocompromised now because of they were stripped of maternal immunity. So that's the young age. And the best way is, measles is happening and we right now have an outbreak, but it's still like about 100 or 200 cases in the whole United States. It's just very unlikely that you even get in contact with anyone with measles. So, but the best thing is to try to avoid exposure for young babies, not to travel in countries where they can contract measles. Just stay put for the first year. And after that, the immune system is capable of dealing with the measles or with other viruses. So then it's like not so much, the vaccine is not so much necessary for them later on as their own immune system is maturing. So it's a very interesting question. In the beginning there are more adverse effects from vaccine, but also more negative effects if disease was contracted. But later on it's like, why are these vaccines even necessary for personal use? in
Okay.
healthy kids.
Okay, good. So then if someone chooses not to vaccinate, and they want to go ahead like my parents did and say, here, hurry up and get this disease and get it over with while you're a active child, and get it out of your system, and you're done. But if say a parent chooses to go to not vaccinate, what can they do to reduce the chances of contracting virus for their children, or moving through it gracefully?
So, I mean, to reduce the chances of contracting a virus, one really has to live in a bubble. Okay. Otherwise, we don't see the virus. We don't know when it's coming at us. So again, if you try to avoid all the public spaces and travel abroad, so that's how you reduce the chances of exposure. But I don't think we want to live in that mentality and be afraid of everything. So I think another way is to strengthen your immune system through nutrition. And we said, it's not so difficult to do. Just you have to follow the guidelines from Western Price Foundation with vitamin A and D rich foods. Vitamin C is another important one. And again, vitamin C does play a role in one of these antiviral innate mechanisms. Mm-hmm. So one doesn't need to overdo and mega dose on vitamin C, but just have enough that one would need for healthy living, rather mm-hmm. than completely avoid any vitamin C foods. So, and I think this is enough. Again, it's not going to prevent measles, it's not going to prevent rash, but it will prevent complications or severity.
Okay, so then when you get it, you just have a normal case, and you're not in that third category that you mentioned.
Not in the third, and maybe not even in the second category. You could be in the first category, having really mild case, or going through it without even knowing you have it.
Okay, but then you build the natural immunity, which is going to stay with you into your later years, rather than reducing and becoming resusceptible in later years.
Yes, and you know what? It looks like children have much easier time dealing with childhood diseases than adults. It's showing up pretty clearly with chickenpox, for example. Adults have much rougher time. Mm-hmm. And it could be because, you know how adults are really stressed out, and stress really eats vitamin C, and there is nothing we can do about stress. It's just everywhere. We just have to live with that. And
but that's where I come in. I teach the meditation.
Yes.
Yes, and healing.
So vitamin C is it's required in adrenal glands to produce adrenaline and everything else, but it also required for the immune system. So immune system and adrenal glands have to share your vitamin C supply. If you use it up a lot in one compartment, there is not enough for another compartment. So, but I think that adults in general are more stressed out and can't control that than children. And even if a disease strikes them, they have to get back to work as soon as possible. They cannot allow themselves to stay home and relax, and no one is taking care of them, right? Yeah. So I think that these complications for adults are coming up more because of what adults have to deal with in their lives, right, and how it affects the whole system. So it's better to go through this in childhood when someone else can take care of kids and let them just stay home and relax and enjoy.
Yeah. Okay. So it's the stress factor and the rest factor.
Yes, I think so. I think that would be in how it affects vitamin C levels.
Okay, great. So that's important for all ages. Just put that out there as well. Okay. So any other tips that you want to share that people can implement right now, people who are listening can implement right now to help them to have a healthier immune system?
So I really don't like to give quick fixes or anything like that. But one more thing that people should look into it, and that would be like a homework. Please look into something called glutathione. And there is a lot of information about glutathione on the web and other sources. Now, glutathione is not a vitamin. It's not something you get from the diet, but it's something that your body produces, and it has to produce in it by itself. But there are ways to improve how your body can produce glutathione, having higher levels, or also know how not to deplete glutathione. So in addition to all these vitamins that I mentioned, I think that glutathione is extremely important for how immune system functions. Without it, it's gonna throw a wrong mechanism at the wrong type of virus, and there will be consequences of that. So yeah, please pay attention to glutathione.
Okay, so now you're giving homework and
Homework,
saying,
yes.
go and research. Where's a good resource to start with on that research?
I'm pretty sure that Google University is a good place to look into. And,
okay, Google University.
Yes,
That's a real thing, right?
Yeah, I do Google search all the time, but then I have to sift through information and see what is reasonable, what is not, and of course we can have further discussion about it. But I think there is really good information on glutathione out there that people can.
Okay. No, I meant that there really is something called Google University that's different from regular Google. Is that true, or did I hear that?
No, I'm just kidding. That's regular Google.
Okay. I actually thought that there really was. Okay. I thought, oh, great, another tool. Okay. But yeah, I mean, we learn a lot through Google. Okay. So now let's see. Any other anything else you want to share with people about either risks of vaccine? I mean, there's and I'm asking that again just because, we didn't say the hot word about vaccines. So many people are worried about vaccines and autism. Can you say a bit about that?
Well, the thing is that there are studies out there, and we know that there is even some research that's coming out of CDC, and there is a lot of controversy about that, how the data was manipulated and how it was reanalyzed by an independent scientist, by Dr. Brian Hooker, and that he came up with a very different outcome from what was in the published research from the CDC. So now people will have to decide whom they believe, whether they believe the CDC or whether they believe Dr. Brian Hooker. So it's not up to me to make that decision. But let's see, if we put that controversy aside and say, okay, let's just look at other things. Mm-hmm. The study that really impressed me, coming from Canada, they looked at the rate of emergency room visits after vaccination appointments. And what they found is that 1 in 168 children ends up in the emergency room after their 12-month vaccination appointment. Okay, and that was in excess of what would happen during a different, window when there was no vaccination appointment preceding it for 30 days. So there is something about vaccination visits, your well baby visits to a pediatric office, and babies ending up in emergency room for whatever reason. I think something is happening that the parent is so scared about what's happening in the child that they have to take the child to the emergency room. Mm-hmm. So what kinds of disease is coming out of that episode, whether it's going to be something that resolves immediately or something that's going to have long-lasting effects, we don't know. But I think it's scary that if you take your baby for a well-child visit and then it's followed up, and so often, it's not 1 in a million, it's 1 in 168, right? That's a very real number that ends up being, needing to be followed up with an emergency room visit. So I think one can, think about it and see whether those vaccinations appointments are worth it.
Okay, fabulous. All right, so Tetyana, you teach classes about the immune system and vaccines, the immune system, and that. Tell us how people can get more information from you if they want to learn more from you or if they want to work one-on-one with you.
Sure. The best way to go about it is just to go on my website, which is www.naturalimmunityfundamentals.com.
Okay.
And
And
just
you need to put the www on your website, right?
yeah, because if you exclude www, it will lead you to nowhere for some reason.
Okay.
Yeah, some kind of glitch. So yes, and that's the website where people can read a little bit on information about me and my classes and see if it resonates with them. If they like the way I approach the analysis of the information that I have, and if so, they can sign up for classes or they can sign up for office hours. I have virtual office hours where people can book me for either group discussion or for personal discussion of their own situation if they need some second opinion or going through the schedule and looking at them together at science that is available to address each vaccine or vaccines in general.
Okay. Okay. And so now is that your one-on-one offer or your group on one offer, or is there another way that people can work with you also?
Yeah, there are just three ways: either to take classes and listen and through the whole information, just to have all this theoretical background and understanding,
Okay.
or if they cannot, they do not want to do it, they can also have just a personal consultation or a group consultation.
Okay. Super. Super. So this is such a sensitive issue, and for parents who want the best for their children, the last thing you want to do, and my heart breaks for the mothers that I know who are struggling with this issue. You don't want to put your child in harm. And it's so hard to know with the rates of autism being, and this is what is like 1 in 49 in a lot of places now. It's really high. For the rates of autism. And I know you haven't said specifically that there's a relationship between the autism and the vaccines, but there is a lot that's what a lot of people are saying. A lot of parents whose children have had vaccine injury or have autism, they're referring to it as vaccine injury. So, it's the last thing that a parent wants to do is to put their child at harm. And yet at the same time, there is so much pressure, and then there's a lot of also information coming from the medical doctors and authorities that says that, yes, you really need to, and you're doing a disservice if you don't. So, for those of you listening, if you're caught in this questioning and you want the best for your child and you're not sure which way to go or what to do, Tetyana is a wealth of information. She's got, she's been involved in the research. She's keyed into all the different studies that have been done in the different places around the world and the different things that affect those studies. And, we hear about them. And, one of the things is we don't realize that, okay, but what was behind this study was, these circumstances in this country, they have these kinds of circumstances, like you said, there's a lack of vitamin A here, or lack of vitamin D here in this country where they did this study. So it might not apply in the same way to the people in the United States, yet these studies are put out there as if they're blanket, and then that's part of, I think, why we get so confused. So, there's so much more than what is on the surface. And this is where Tetyana can help you to understand what applies to your family, to your history, to your circumstances, and maybe give you some guidance on, how to, as we said in the discussion here, how to reduce the adverse effects or move through childhood and the natural childhood viruses and diseases that we get in a graceful way, reducing the chances of the severity, the more severe cases, if you choose to go that route. So I'm encouraging you that if you have those questions, you don't have to struggle on your own. This is an amazing resource and an unbiased, I feel, probably one of the most unbiased resources that I'm aware of. So I want to thank you for that, Tetyana.
Thank you, Deborah. It was really a pleasure to be here with you.
Thank you. So again, that's www.naturalimmunityfundamentals. Did I get that right?
Yes.
Naturalimmunityfundamentals.com, and put the www in front of it so you make sure and get to the right place. And again, don't struggle on your own. Give her a call. She's amazing. She's amazing and so approachable and so easy to work with. It's fabulous. So thank you all for listening, and thank you again, Tetyana. And please, if you liked this, tell your friends about it and make sure that they get into this summit and listen to this interview, and all of the other amazing speakers that are with us as well. So thank you for listening. Stay tuned for more. Check your inbox for what's coming up next. Thanks a bunch.